This is the third and final part of health economics lecture series, and in this we will be quickly and discussing the health cost evaluation. So there are two broader approaches of health cost evaluation. One is societal health costs, and the second one is health system costs, like hospitals, health system of the hospitals. And so the first one, societal health cost. In this we will be looking at different types of cost. So major three types of health costs. Number one, patients health costs, which are mitigation costs. These include medicine, hospital cost, hospitalization cost, diagnostic costs, transportation cost, through which a patient is taken to the hospital. These are kind of direct health cost in societal portion. Now the second is productivity loss due to illness, means work days loss. Suppose when you are ill and you are unable to go to work, so there will be an economic loss, because maybe if you are absent for 3 days and the organization cut 3 days of your salaries, right? Or if you are doing a business and you are unable to go to your shop or your company or organization, and there is a business loss, so it is a productivity loss. And third is psychological costs, means these are intangible costs. These are mostly evaluated through open-ended interviews with the patient or a person. So in first we will study the models, types of models for the number one, patient's health cost, means mitigation cost. So these costs are where the outcome variable values are monetary, again quantitative, but can be continuous data values. So these costs are measured through simple linear regression model, which is like this, like health expenditure on illness, means health mitigation cost due to illness is equal to intercept plus beta for mitigation cost plus error term. While multiple linear regression model is simple linear regression model, but with a more independent variables here. A model which estimates the effect of multiple independent variables on the dependent variable, like the health expenditure or health cost, which is our dependent variable. So multiple beta, like mitigation cost plus use of mosquitoes nets or mosquitoes repellents, plus your income level, plus income, plus education, etc., or the structure of your household, whether your house have proper sanitation system or water supply system. So you can add plenty of societal variables into this model. So this is a simple multiple linear regression model with more than one independent variable. Now in societal health mitigation cost analysis, if you collect data from household or from certain community, there might be a lot of people within the community who has zero monetary health cost, right? So instead of then multiple linear regression model, which is a very simple and basic model, you can use a Tobit model, which is also called censored regression model, in which we do left or right censoring. Like if you have a lot of zeros, monetary cost values range is such that 0, 500, 700, 1300, 650, 0, 0, 1400, 550, etc. There will be hundreds of values. So if there are a lot of zeros, then you can only do a left censoring, means censor the zeros, and then you will get a more efficient beta estimate. And if your data contains a lot of zeros as well as very high values such as this 1300, which is outlier, you can do right censoring also, means when you do left censoring, you will say that include values in my model greater than 0. So zeros will be censored, and up to the limit at right censoring, up to the limit of 700. So above 700 values of health cost, monetary cost or mitigation cost will be right censored, mean 1300 will be dropped and 1400 will be dropped. So your data will be from 500 to 700 range. So this the Tobit model gives you the option to censor extreme lower and extreme upper values to get more precise average health monetary cost values, right? And now the second one is productivity loss, which is workday loss. Now for such kind of health cost analysis, there are completely different types of models. Workday loss. Why? Because in productivity loss, mostly your health cost will be count data values, right? Discrete counts of illness. Like suppose in 1 month, one person in a society or in a community which you are evaluating may be ill for 2 days, one might be ill for 3 days or 7 days, means it will be a discrete values, like discrete positive count data of illness, like 0, 1, 3, 2, 7, 11. So when the dependent variable is of this nature, in the last income or productivity loss models, the parent model or the best model is to estimate is the Poisson regression model, in which the dependent variable values are like this discrete quantitative values. Now when you estimate this model, you might experience a very large dispersion. Like here there are zeros, there is 11, and the values might be of 100. I will just put 6 7 values just for understanding, but these values, your sample size might be in hundreds or might be in thousands, so there can be a dispersion. Now in order to see or check whether there is a dispersion, you have to estimate an extension of the Poisson regression model, which is called negative binomial Poisson regression, which is an extension of Poisson model with a dispersion parameter alpha, that how much there is dispersion in these outcomes, your work days loss, how much dispersion. Now when you estimate a negative binomial Poisson regression model, if the alpha value is significant, so there is a dispersion, means either there are a lot of bigger values or there are a lot of zeros, right? Now you can go through your data. So the sample size might be in thousands. You can do some use some command in stata program and see if there are a lot of zeros. So if there are a lot of zeros, means 0 work days loss in your sample size, then you can do truncation, which is called zero truncated Poisson regression model, a Poisson model without zeros. So zeros will be truncated and you will get estimate for work days loss WDL without dispersion, means without zeros, and you will estimate model of values greater than zeros of 1, 3, 2, 7, 11, 9, 15, 14, 13, etc. Right? Now in order to go further extended analysis, you can also do zero inflated Poisson regression, which is also an extension of Poisson model, which estimate two models inherently, means coherently. Model 1 will estimate greater than 0 values of illness, means from 1 to 11, like this. So model 1 will give you result for the values, workday WDL values of greater than 0, and model 2 will estimate binomial model. Binomial means where illness or health status is taken as binary, like 0 for not ill and 1 for ill. Now if the beta values changes a lot, if you see, you will see the values of beta in your output in a stata program or whatever computing or data analytical software you are using. So you will see if there is a lot of changes in your beta, then you can also conclude that whether there is a dispersion or not, right? So these models, either you can use this one first and then this one, or this one first and neglect this one. You can get idea about dispersion in WDL from zero inflated Poisson model. Okay, so now the third one is here the psychological cost, intangible cost. So these are mostly measured through health status models, like logistic models or pure qualitative model research models, right? So the third one is health status. Health status can be measured through logistic regression models. Like logistic regression, it estimates the probability of an event occurring, such as voted or didn't vote, ill or healthy, or can be more than 2, and more than 2 either they can be unordered or ordered based on a given data set or construction of the variables, right? So if your health status is binary, like either you are ill or not ill, means healthy, then the best model is binary or binomial logistic model, where the outcome has two categories affected by either nominal or continuous independent variables. So health status can be labeled as per ill or healthy. Your health status here is a dependent variable, or if your health status dependent variable is more than 2 categories, then you should use multinomial logistic model, where the outcome has more than 2 unordered categories affected by either nominal or continuous variables. Here health status can be labeled with more than 2 statuses depending on evaluation objectives or your variables design, right? Now if your health status is more than 2 categories, but they are in order, then you should use ordinal logistic model, where the outcome has more than two ordered categories affected by either nominal or continuous independent variables. Here, health status can be labeled with more than two statuses depending on evaluation objectives, like number 1, lowest order of the health status, to either 3 or 5 or 7 for higher or better health statuses. Now remember that there is one assumption which you should test, and this is called parallel line assumption. Let me put this here. This parallel line assumption actually check whether there is order in your health status variable or not. If there is no order, means if the test failed, then the multinomial logistic model should be used instead of ordinal logistic model, right? Thank you. I hope you will understand this societal section of it. Now the second one is health system cost. So in health system costing, there is hospital infrastructural cost, which are also known as fixed costs, medical or pharmacy cost, medical equipment cost like capital cost, which can also be fixed costs like X-ray machines or CT scan machine. There are also variable costs like telephone, electricity, and other bills, etc., which varies with day-to-day usage of them. And fifth is recurrent costs or depreciation cost, which are calculated via straight line depreciation method, right? Straight line depreciation method. And also in health system cost, we also actually measure the number of outpatient, inpatient cases, mortality cases, etc. So these are also measured in health system cost analysis, right? So then the health system cost, I will make a separate video for it, that how you should know about what are the fixed costs, what are capital costs, what are variable costs, and what are the recurrent costs, which help in budgeting in the health sector, right? And what is the straight line depreciation method, in which we calculate recurrent cost. Like suppose if you buy an X-ray machine for 10 lakh rupees, and its shelf life is 10 years, so you will divide 10 lakh divided by 10 years, right? So you will get 100,000 value. So 100,000 will be a recurrent annual cost for X-ray machine, which you should put in your budget, right? Thank you.